So consuming the placenta, when some people hear about this, they're like, ooh, why would anybody want to do that? But there are reasons for considering consuming the placenta. And before I get into what those reasons are and what the potential risks are, I want to note one big thing that comes up when you mention, like, I'm thinking about encapsulating my placenta or eating my placenta. There's a lot of judgment, or there can be a lot of judgment. People saying, ew, why would you ever do that? That's so gross. And what I want to say is nobody has a right to judge you for that choice. Ultimately, it is 100% your choice if you want to consume the placenta or not. And I think it's kind of ridiculous when people try to shame women out of doing it. And of course, if you have a friend that's like, oh, you know what, I tried it and I had this adverse effect, that's different. But I really hope for you that shame isn't a part of your decision, or you're thinking like, I really want to, but I'm embarrassed and I think the people around me will make fun of me. Don't let that be part of your decision. Do what makes you feel good. And hopefully this video will help you clarify that decision, or at least send you on the path to more clarity. Okay, so first of all, why is there all of this judgment? A lot of people, when they think about consuming a placenta, they picture the like raw organs still warm from the body and somebody like dicing it up and throwing it in a saucepan or in a smoothie and then like gulping it down. Sure, that might be kind of how some people do it, but most women that talk about consuming their placenta, they get it encapsulated first. And so with encapsulation, what does that mean? That usually means that the placenta is washed, steamed for quite a long time, sometimes with some herbs, dehydrated, ground, and then encapsulated. So usually it's a pretty sterile process depending on who is doing it. And before I get into the pros and cons, I want to mention that this whole topic is pretty controversial because there's not a lot of research that's been done on it. There's a lot of like anecdotal evidence and some small studies. So that's the tricky thing. Like, I can't definitively say, yes, consuming your placenta is wonderful and you're guaranteed all these benefits. Or that, oh yeah, if you do it, you are guaranteed like all of these horrible risks. We just don't really know. So I'm going to give you the information I have. Do with it what you will. Okay, so first of all, why do so many women consume the placenta? So anecdotal evidence, meaning just women saying like, hey, I had this benefit, has shown that ingesting the placenta can potentially increase your energy, balance out hormones, prevent anemia through restoration of iron levels. However, some research on placenta pills have shown that they actually have pretty low levels of iron, but again, those are just some pills that were tested. And some believe that it also helps to lower your chances of postpartum depression. That all sounds great, right? Some people say that all of those are placebo effects, but honestly, as somebody that's a big believer in the mind-body connection, even if it is just placebo effects, I don't think there's anything wrong with that. So those are potential benefits. In regards to risks, there are some potential risks. So group B strep, it's something that I had going into birth. There is a possibility that group B strep can infect the placenta, and then when the mother re-ingests it through the placenta pills, that the group B strep could get into the breast milk. And that has happened before. I also know plenty of women that had group B strep, had their placenta encapsulated, took the pills, and nothing happened. So it's not like if you have group B strep and you encapsulate your placenta and you take those pills, it's guaranteed to pass through the breast milk. That's not necessarily true. But if you test positive for group B strep, I would just like consider that risk and definitely talk to your care provider about it. Okay, so in addition to group B strep, There's the possibility for the placenta to be contaminated by other intrauterine infections. And there's also the potential for contamination during the encapsulation process if it's not handled properly. So that's why I'm going to go through a really thorough list of questions in a minute that you want to ask any potential encapsulator to make sure they know what they're doing and they're going to have a really clean, sterile environment for the encapsulation. Okay, so hormones are the other potential risk, not so great side effect or not so great potential side effect of encapsulating the placenta and taking the pills. Okay, so estrogen in the placenta pills could potentially increase your risk for blood clots, and the presence of progesterone could impede prolactin, which is responsible for milk production, and estrogen can also suppress prolactin. So it's interesting when you hear women talk about consuming their placenta, some say, oh my gosh, it like really increased my milk supply and it totally changed the game regarding breastfeeding. And I've also talked to women that said, oh yeah, once I started taking those pills, my milk supply just dried up. So they just impact each woman differently. And I'll get to what to do about that in the end. Okay, so what to do? I definitely recommend talking to your care provider, knowing that, especially if you have a more traditional care provider, they'll probably say, because there's not enough research, I can't recommend it. So that's probably what they'll say. If you have a midwife, he or she might have bit more of an open mind about it, but I still think it's worth talking to your care provider about that potential decision. And then beyond that, if you feel like my care provider might be a little bit biased or they're just too conservative, then I would recommend interviewing a few different placenta encapsulators and really picking their brain with the following questions, just so you have a really well-rounded view. And then of course, if you know any women that have actually consumed their placenta pills, ask them what their experience was like. Okay, so here's questions to ask a placenta encapsulating specialist. Good old Google or referrals are a great way to find placenta encapsulators in your area. Okay, so first and foremost, did you receive formal training and certification? What did that consist of? Because all training and certification is not created equal. And do you engage in continuing education, which is also really important, because if continuing research finds that, oh wait, like if you don't do X, Y, and Z when encapsulating the placenta, it can be really dangerous. So you want your placenta encapsulator to be up to date on the most recent research. How many placentas have you encapsulated? Preferably that number is high. What are the risks of placenta encapsulation? Have your clients had any adverse effects? I would be a little bit wary of somebody that's like, no, there's absolutely no risks. I personally would want somebody that's like, yeah, there's some risks. Here's what they are. This is how I can potentially help you avoid those risks. You want somebody that's straight up. Okay, next, are there certain STDs or infections that would rule me out as a candidate for encapsulation? Again, this could hopefully start the conversation about, something like group B strep. How do you handle and store the placenta before you're ready to encapsulate? You want to make sure they have really clear protocol to care for the placenta before encapsulation. Where do you encapsulate, and what are your sanitation procedures for the equipment and the workspace? Again, you want it to be super, super sanitary. Would you be willing to encapsulate in my kitchen if that's what I'm most comfortable with? So some women understandably are a little bit hesitant to have the placenta go somewhere else, into a home usually that they haven't been in. They don't know what the sanitation practices are there, and so they feel more comfortable having the person come to their home and do it in their kitchen. I think that is absolutely your right to ask for that if that makes you feel more comfortable. How do you make sure my placenta isn't mixed up with someone else's? That's a big one. How do you encapsulate the placenta? What I outlined above is like pretty general, but for example, maybe when they steam it, they do use certain herbs. So it's interesting to hear how each specific specialist goes through the encapsulation process. What temperature do you use to steam the placenta, and is it high enough to kill potential blood-borne pathogens? That's an important one. What do you encapsulate the powder in? Will you be immediately available to pick up my placenta? If not, how should I store it until you arrive? Preferably, the placenta encapsulator will make themselves available to come and get the placenta from you. And of course, sometimes you need to store it in this like cooler box thing for a couple hours before they can come. But ideally, they're going to come to you and get it versus you having to drive it to them, which is a pain in the butt, especially right after you had a baby. How soon will you deliver my pills? And will you provide a dosage recommendation? So if you decide to move forward with it and you find a really great placenta encapsulator who you really trust, I would really pay attention to how they make you feel. So if you are taking them for a few days and you start to feel kind of down and your milk supply drops, I would stop taking them for a few days to see if those not so great side effects go away. If they don't go away, if they don't really change, then maybe it wasn't because of the placenta pills at all. It's just your hormones shifting and, you know, your body getting used to motherhood. But if those symptoms immediately go away, then it might have been the placenta pills. So because there isn't much quality evidence around this, you're kind of like the guinea pig with the pills. It works out great for some, not so great for others. But again, don't just blindly take them. Really pay attention to how they make you feel and stop them if you notice adverse effects. All right, I hope this was helpful. If you have any questions, let me know in the comments below.